Welcome to ECHOMAP, the practical, easy, and useful ultrasound for general practitioners. Today, we're going to talk about lymph nodes, about suspicious lymph nodes, and lymph node tumors. Just a reminder, right now you can take advantage of a free ultrasound training. The link is in the description. I invite you to join me for this training to learn as much as possible about ultrasound. A completely free training with 18 modules that will help you master your ultrasound device in every way, settings, modes, and more. I'll show you how to optimize your image, how to get high quality images, how to avoid common pitfalls, and I'll share my tips and tricks too. It's totally free. Just click the link, join me in the training, and I'll see you very soon on the other side. So, for today's clinical case, we have a 66-year-old patient who came in for a consultation because he had lumps developing under his arm. They were starting to become painful and were bothering him at work. He's an agricultural worker. And indeed, during the examination, you could feel numerous hard, fixed masses in the axillary hollow, which were clearly very suspicious. So, let's take a look at what we find on the ultrasound. As soon as I placed the probe, the first and largest mass I found was actually this one. Overall, you can see that there's a cluster of multiple heterogeneous hypoechoic masses present in this patient's axillary region. So I thought this clinical case would be an absolutely perfect opportunity for us to review together what the criteria are for suspecting axillary lymphadenopathy. As always, with ultrasound, you have to keep things simple so you don't get lost, and you need to have a clear understanding. So, quite simply, like with any ultrasound image, we're going to analyze the size, the number, the shape of our lymphadenopathy, and its appearance. Overall, its echogenicity, and of course, its vascularization, since every ultrasound image should get a quick look with Doppler. So, regarding the criteria for suspicion, well, when it comes to size, a lymphadenopathy should be measured in the transverse plane, not along its length in the sagittal plane, but specifically in the transverse direction. The transverse diameter greater than 10 millimeters is considered suspicious. The number, of course, not necessarily in terms of suspicion for a tumor, since it could also indicate reactive or inflammatory lymphadenopathy, but having more than 3, a cluster of more than 3 lymph nodes, is suspicious. Shape. Any lymph node that becomes round, that no longer has an elongated shape, normally the length is about twice the thickness of a lymph node. Any lymph node that starts to become round is suspicious. The overall appearance of our lymph node, of course, especially with the loss of the central hilum, the central hyperechoic hilum, the echogenicity, a lymph node that becomes heterogeneous, that undergoes central necrosis with an anechoic area, that shows cystic compartments, and finally, vascularization that is no longer hilar or central and ultimately is quite difficult to detect with the ultrasound device, but becomes intense, chaotic, and mainly peripheral. So those are the criteria for suspicion. Any suspicious criterion for a lymph node, even a single suspicious criterion, should prompt further investigations, either with additional imaging or even with a direct biopsy of the lymph node. But in any case, any criterion should lead to further exploration. Now let's go back and take another look at our lymph node. Is it suspicious? Well, of course, just at first glance, right away, you can tell it's suspicious. First of all, it's large. Now, we don't have the exact scale, but as you can see here, it's not measured, but it's definitely well over 1 centimeter. Since here we have 50 millimeters, 1 centimeter, you can see that our lymph node is easily 2 centimeters along its longest axis. As for the number, we'll see on the dynamic images, but in fact, it's a cluster of numerous axillary lymph nodes. Here you can see one that looks much more typical here, with its hilum and peripheral cortex. A lymph node here, very altered as well. The rounded shape, of course, this lymph node is completely round, with very irregular borders as well, which also fits the criteria for suspicion. Not just the shape, but the overall appearance. So the overall appearance specifically is heterogeneous, very heterogeneous. There's no central hilum left at all. We just have a lymph node. You can tell it was a lymph node originally, but you can't really recognize it as a lymph node anymore. So, as we mentioned, the echogenicity is very heterogeneous. And then the vascularization becomes chaotic. There's no more hilar vascularization, which is normally very typical, as you can see here. Here, you can see that the vascularization, even though it's intense, comes from the hilum. Here, the vascularization is no longer really present at the hilum. On the other hand, the peripheral vascularization is extremely significant. All this area of vascularization is starting to become very chaotic. So in dynamic mode, this is what the exploration looks like. Here you can see our two lymphadenopathies side by side. You can see here the absolutely intense remodeling of the area. In the end, only this lymphadenopathy is starting to show suspicious criteria. We'll get to that, but it still looks relatively normal. Here you really have this completely chaotic lymphadenopathy, very irregular, very heterogeneous, with these hyperechoic areas that we don't really understand, and this irregular outline. So there you have it, a clearly suspicious lymphadenopathy. Another lymphadenopathy was studied. Is this lymphadenopathy suspicious? Well, yes, it is suspicious, because it shows, especially here in the hilar area, cystic spaces. So it meets a criterion for suspicion, which is the presence of anechoic spaces, cystic spaces within the lymphadenopathy. Now, this lymphadenopathy is also suspicious. Very intense vascularization that is no longer just hilar. It extends beyond the hilum, and the vascularization gradually becomes chaotic. So another criterion for suspicion in another lymphadenopathy in this patient. And for this lymphadenopathy, you might think it's more typical, but again, there's disappearance of the central hilum in both of these lymphadenopathies, and a shape that is gradually becoming more rounded. Especially even for this one, which is no longer quite twice as long as it is thick, but mainly for that one. So, two lymphadenopathies that are starting to become round and have lost their classic appearance of a central hilum. So this patient was biopsied, and it turned out to be a lymphoma, a 66-year-old patient who had lymphoma. So I hope you enjoyed this training, that this little lesson on suspicious lymphadenopathies was helpful for you, that it brought you a lot, and that it really refreshed the suspicion criteria in your mind in a very clear way. We looked at several examples, and it was really a chance to review the key points about suspicious lymphadenopathy in particular. Let me remind you that you currently have access to a free ultrasound training, and the link is in the description. Just click on it and join us for a great course so we can make progress together, and to really learn how to use this amazing tool that is ultrasound. And I'll see you very soon on ECHOMAP.